gosh, sir, are you okay?
Help!
Hello, sir. This is an emergency. There's a person here who is injured. Can you please come over? Yes, at the street. Thank you. No worries, sir. Help is on the way.
Anna, what happened to this man?
I saw the accident at the road and he was already laying down and he probably got hit by a truck and his forehead was bleeding so much.
Michelle, Alexis, come here. Let's bring this man to the ER.
Okay, let's bring Dexter to the emergency room, and Nurse Michelle, can you please call Dr. Doreza?
I will call doctor now. Hello doc, there's a patient Dexter in the ER that needs to be checked right now.
Okay, I'll go with you to the ER. I will just get the necessary equipment for me to check his vitals. Oh, sir, can you hear me, sir? Let me check your vitals first, sir. Okay, your vitals are normal. Sir Alinsub, you have been injured in your head area. Your vitals are normal, but you need to undergo the CT scan so that we are able to know the damaged or injured area inside of your head or the skull. So, Miss Michelle, can you please request for the transport so that Sir Alinsub should be delivered there as soon as possible? Okay, Sir Alinsub, please stay calm and stay put there.
Doc, what is inside the skull?
So, what is skull? So, skull is the bony structure that forms the heads and vertebrates. So, it supports the facial structure and provides protective cavity for the brain. So, the skull is composed of two parts, the cranium and the mandible. So, the skull is also a part of the skeletal system. So, this is the representation of human skull in lateral view with labeling. First one is the coronal suture. So, this is the line of junction between the frontal bone and the two parietal bones of the skull. The parietal bone. These are bilateral skull bones that form the superior and lateral walls of the cranium. The temporal bone. This is the pair of bilateral, symmetrical bones that constitute a large portion of the lateral wall and base of the skull. So we have the lambdoid suture. So this is a dense, fibrous connective tissue that connects the parietal bones with the occipital bone. The squamous suture. So it is the cranial suture between the temporal and parietal bones bilaterally. In the lower part, we have the occipital bone. It is the trapezoidal shaped bone found at the lower back area of the cranium. Then, the occipital is cupped like a saucer in order to house the back part of the brain. The next label, we have the zygomatic process, or it is also known as the cheekbone or the malar bone. It is a paired irregular bone which articulates with the maxilla, temporal, sphenoid, and frontal bone. Next, the external acoustic meatus. It is a bony canal for the ear canal, a tube running from the outer ear to the middle ear. Next, we have the mastoid process. It is a smooth conical projection of bone located at the base of the mastoid area of the temporal bone. We have the styloid process. So it is a slender pointed piece of bone just below the ear. It projects down and forward from the inferior surface of the temporal bone and serves as an anchor point for several muscles. Then we have the mandibular ramus. It is a quadrilateral process projecting upward and backward from posterior part of the body of the mandible and ending on the other side at the temporomandibular joint in a saddle-like indentation.
So, as you can see, we have here the frontal bone. It is located at the yellow part of the human skull. The frontal bone forms the forehead, the bony projections under the eyebrows, and the superior part of the eye's orbit. Next, we have the sphenoid bone. It is located at the pink part of the given human skull. It is a butterfly-shaped bone that spans the width of the skull and forms part of the floor of the cranial cavity. Next, we have the ethmoid bone, which is located at the orange part of the given human skull. The ethmoid bone is very irregularly shaped and lies anterior to the sphenoid. It forms the roof of the nasal cavity and part of the medial walls of the orbits. Now we have here the lacrimal bone, which is located at the green part of the given human skull. The lacrimal bones are fingernail-sized bones forming part of the medial wall of each orbit. Each lacrimal bone has a groove that serves a passageway for tears. Now we have here the nasal bones. It is located at the blue part of the given human skull. The small rectangular bones forming the bridge of the nose are called nasal bones. Now we have here the zygomatic bone, which is located at the purple part of the given skull structure. Zygomatic bones are commonly referred to as the cheekbones. They also form a good-sized portion of the lateral walls of the orbits. Now here's another bone called maxilla. It is the purple part of the human skull. The maxillary bones are also called as maxilla fuse to form the upper jaw. All the facial bones except the mandible join the maxilla. Thus, they are the main or the keystone bones of the face. Maxilla also carries the upper teeth of the alveolar process. Next bone is the mandible. It is located at the red part of the human skull. The mandible, or also called as the lower jaw, is the largest and strongest bone of the face. It joins the temporal bones on each side of the face, forming the only freely movable joints of the skull. Superior view of a human skull. So this is the superior view of a human skull. The top of the cranium is removed. You can see there the frontal bone, which is located at the yellow portion of the human skull. We can see the sphenoid bone on the pink portion and the temporal bone on the orange portion, and also we can see the occipital bone on the brown portion and the parietal bone on the green portion. Now let's go to the ethmoid bone. The ethmoid bone has two classifications: the cribriform plate and the crista galli. The cribriform plate is a narrow with deep grooves supporting the olfactory bulb and is perforated by the olfactory foramina, allowing the passage of the olfactory nerves. The crista galli is the upper part of the perpendicular plate of the ethmoid bone, which rises above the cribriform plate. Now, let's move on to the optic canal, sella turcica, and foramen oval, which is located at the sphenoid bone. The sella turcica is a saddle-shaped depression in the body of the sphenoid bone of the human skull. The optic canal is a cylindrical canal running obliquely through the lesser wing of the sphenoid bone, near the base where it joins the body of sphenoid. It transmits the optic nerve and ophthalmic artery. The foramen oval is an oval-shaped opening in the middle cranial fossa, located at the posterior base of the greater wing of the sphenoid bone. Now let's move on to the occipital bone, where the jugular foramen and the foramen magnum is located. The jugular foramen is a large foramen in the base of the skull, located behind the carotid canal.
Meanwhile, the foramen magnum is a large oval opening in the occipital bone of the skull. It is one of the several oval or circular openings in the base of the skull. Now let's go on to the temporal bone, where the internal acoustic meatus is located. The internal acoustic meatus is a canal within the petrous part of the temporal bone, between the posterior cranial fossa and the inner ear.
Incisive fossa. A depression in the front of the maxillary bone above an incisor teeth. Maxilla. The maxilla is the bone that form your upper jaw. The right and left halves of the maxilla are irregularly shaped bones that fuse together in the middle of the skull. The nose in an area known as the intermaxillary suture. The maxilla is a major bone of the face. Sphenoid bone. The sphenoid bone is the most complex bone of the body. Because of its shape, it is also known wasp bone. It makes up most of the middle part of the base of the skull and contributes to the floor of the middle cranial fossa of the skull. Foramen oval. The foramen oval is another opening at the base of the greater wing of the sphenoid. It is positioned posterolateral to the foramen with the middle cranial. It conducts the mandibular nerve branch of the trigeminal nerve and the accessory meningeal artery. Carotid canal. The carotid canal is the passageway in the temporal bone through which the infernal carotid enters the middle cranial fossa from the neck. The canal starts in the inferior surface of the temporal bone at the external opening of the carotid canal, also referred to as the carotid foramen. Jugular foramen. The jugular foramen is situated in an oblique plane along the skull base. Its boundaries include the petrous temporal bone anterolaterally and the jugular process of the occipital condyle. Posteromedially, the jugular foramen is usually larger on the right than on the left. Occipital condyles are large protuberans on the undersurface of the occipital bone located beside the front half of the foramen magnum. It forms the connection between the skull and the vertebral column, which function in articulation with the superior facets of the atlas vertebra. Foramen magnum. The foramen magnum as a passage of the central nervous system through the skull, connecting the brain with the spinal cord on either side of the foramen. The foramen magnum is the largest foramen of the skull. It is located in the most inferior portion of the cranial fossa as a part of the occipital bone.
The human skull has two hard palates. The maxilla is the bone that forms your upper jaw. The right and left halves of the maxilla are irregularly shaped bones that fuse together in the middle of the skull, below the nose in an area known as the intermaxillary suture. The maxilla is the major bone of the face. The palatine bone is a paired bone located between the maxillae and the pterygoid process of the sphenoid bone. It participates in building the three cavities within the skull: the oral cavity, the nasal cavity, and the orbits. This bone features three processes: the pyramidal, orbital, and the sphenoidal. In the human skull, the zygomatic bone, or so-called as cheekbone or malar bone, is a paired irregular bone which articulates with the maxilla, the temporal bone, the sphenoid bone, and the frontal bone. The temporal bone is a thick, hard bone that forms part of the side and base of the skull. This bone protects nerves and structures in the ear that control hearing and balance. The vomer is a small, thin, flow-shaped midline bone that occupies and divides the nasal cavity. It articulates inferiorly in the midline with the maxillae and the palatines, superiorly with the sphenoid via its wings, and anti-superiorly with the ethmoid. The mandibular fossa or glenoid fossa is an oval depression behind the anterior root of the zygomatic process of temporal bone for the reception of the condyle of the mandible. The styloid process is a slender pointed piece of bone just below the ear. It projects down and forward from the inferior surface of the temporal bone and serves as an anchor point for several muscles associated with the tongue and the larynx. Mastoid process is a smooth conical projection of bone located at the base of the mastoid area of the temporal bone. It is located posterior and inferior to the ear canal. It forms a bony prominence behind and below the ear. The zygomatic process of the temporal bone is a long, arched process projecting from the lower part of the squamous portion of the temporal bone. It articulates with the zygomatic bone. Its main function is to provide structure and strength to the midface. Processes are projecting pieces of bone that insert into other bones. The parietal bones are two bones in the skull which, when joined together at the fibrous joint, form the sides and roof of the cranium. In humans, each bone is roughly quadrilateral in form and has two surfaces, four borders, and four angles. The occipital bone is a cranial dermal bone and the main bone of the back and lower part of the skull. It is trapezoidal in shape and curved on itself like a shallow dish. It overlies the occipital lobes of the cerebrum.
The posterior and lateral views of the skull show us important bones that maintain integrity of the skull. Posterior region protects the region of the brain that contains the occipital lobes and cerebellum. It includes sagittal suture, parietal bone, lambdoid suture, occipital bone, and mastoid process of temporal bone. The sagittal suture is a dense, fibrous connective tissue joint between the two parietal bones of the skull. The parietal bone are two bones in which the skull, when joined together at a fibrous joint, form the sides and roof of the cranium. The lambdoid suture is a dense, fibrous connective tissue joint on the posterior aspect of the skull that connects the parietal bones with the occipital bone. The occipital bone forms the base and back wall of the skull. The occipital bone joins the parietal bones anteriorly at the lambdoid suture. And lastly, the mastoid process of temporal bone is a smooth conical projection of bone located at the base of the mastoid area of the temporal bone. It allows attachment of muscles.
Interior view of the skull. First, we have the coronal suture. The coronal suture runs from side to side across the skull within the coronal plane of section. It joins the frontal bone to the right and left parietal bones. Parietal bone. The parietal bone forms most of the upper lateral side of the skull. These are paired bones with the right and left parietal bones joining together at the top of the skull. Each parietal bone is also bounded anteriorly by the frontal bone, inferiorly by the temporal bone, and posteriorly by the occipital bone. Nasal bone. The nasal bone is one of the two small bones that articulate or join with each other to form the bony base or the bridge of the nose. They also support the cartilages that form the lateral walls of the nose. These are the bones that are damaged when the nose is broken. Sphenoid bone. The sphenoid bone is a single, complex bone of the central skull. It serves as a keystone bone because it joins with almost every other bone of the skull.
The sphenoid forms much of the base of the central skull and also extends laterally to contribute to the sides of the skull. The ethmoid bone is a single midline bone that forms the roof and lateral walls of the upper nasal cavity, the upper portion of the nasal septum, and contributes to the medial wall of the orbit. On the interior of the skull, the ethmoid also forms a portion of the floor of the anterior cranial. Lacrimal bone. Lacrimal bone is a small rectangular bone that forms the anterior medial wall of the orbit. Zygomatic bone. The zygomatic bone is also known as the cheekbone. Each of the paired zygomatic bones forms much of the lateral wall of the orbit and the lateral inferior margins of the anterior orbital opening. Infraorbital foramen. It is an opening in the maxillary bone of the skull located below the infraorbital margin of the orbit. Maxilla. It is the upper fixed bone of the jaw formed from the fusion of two maxillary bones. It is superior to the mandible. Mandible. It is the largest bone in the human skull. It holds the lower teeth in place. It assists in mastication and forms the lower jawline. Mental foramen. Mental foramen is one of the two foramina openings located in the anterior surface of the mandible.
So hi everyone. First is frontal bone. Is a bone in a human skull. The bone consists of two portions. These are the vertically oriented squamous part and the horizontally oriented orbital part, making up the bony part of the forehead, part of the bony orbital cavity holding the eye, and the part of the bony part of the nose respectively. So next is the superior orbital fissure. Is the communication between the cavernous sinus and the apex of the orbit. It is straddled by the tendinous ring, which is common origin of the four rectus. So next is the optic canal. Is a cylindrical canal running obliquely through the lesser wing of sphenoid near the base where it joins the body of sphenoid. It transmits the optic nerve and ophthalmic artery. So next is the temporal bones. These are situated at the sides and base of the skull and lateral of the temporal lobes of the cerebral cortex. The temporal bones are overlaid by the sides of head, known as the temples, and house or structure of the ears. So next is the middle nasal concha. Consists of the medial surface of the labyrinth of ethmoid, which is a thin basal lamella that descends from the undersurface of the cribriform plate and ends in a free convoluted margin. It is rough and marked above by numerous grooves directed nearly vertical downward from the cribriform plate. They lodge branches of the olfactory nerves, which are distributed to the mucous membrane covering the superior nasal concha.
Oh my God, I hope he's okay. Miss, is my brother okay? Is he in a critical condition? Miss, please save my brother.
What's your name again? Oh, Jam. Your brother is fine though, but he still needs a few days for him to heal. He doesn't have any major fractures, and maybe 2 weeks from now he'll be okay. Don't worry.
Oh, thank God he's okay. Thank God. Thank you, Miss. Thank you for saving him.